Look, I think the right time to have a baby is when the woman and her partner want to have a baby. But in biological terms, believe it or not, it's probably between the ages of 15 and 25. Now, that doesn't fit with our social construct at this time. We all have career aspirations and financial aspirations, and I think, we have evolved from that biological imperative. But really, ideally, 25 to 30 is probably a very sensible time to be considering planning having a family in real terms. But the right time is when the couple want it.
Okay. This is another question that I get a lot, and I guess it sort of kicks along from what we've just been talking about. So you're a woman, you're 35, your career is now moving along nicely, you're single, you're starting to think about things that you may or may not miss out on in life, you really want to have children. What are your options at this stage, and what are your best options for thinking about having a baby in those circumstances?
Oh, it's a very difficult question. There are many women in this situation, and I hope that it will be reduced as time goes on by education and community information. This has been a subject of much debate in fertility groups. Should we be offering egg freezing? Should we be offering donor sperm and embryo freezing? Should we be offering donor sperm? I always, tongue-in-cheek, say, look, all those treatments are very expensive, and a dating agency is probably a lot cheaper. The thing is to find a partner who wants to share in that reproductive goal that the woman has. Unfortunately, there is a bit of a lag time to the establishment of a relationship which is sufficiently secure and mature enough to be able to parent children and to feel confident in parenting children, and that lag phase is probably about 2 years. So then you've really got to be only trying for about 6 months, and then you've got to be hightailing it to a doctor to get some intervention before it's too late. But all those other options are available. It's very difficult to know what their place is, and I think it's important not to use them to give women a false sense of security. Egg freezing, whilst it has improved with a process called vitrification, which is a new process of freezing eggs, it's still very poor, and it is actually still quite poor when women have eggs that are aged 35 years.
Okay, well, just following on for that, is there any advantage to women to staying on the pill on the basis that as it prevents ovulation, they've got a larger store of eggs? Is there any logic in that?
That's an absolutely super question. Absolutely super. Look, there isn't any evidence that menopause is later if you take the pill for all of your life.
Okay.
And I think the best way to think about this is when we're about 20, we have about 20 contenders for ovulation. And out of those 20 immature eggs, one of them will ripen and become ovulated and potentially fertilised by the sperm. And the other 19 fritter away in a process that we call atresia. And when we're about 30, it might be 10 eggs, and one ripens up and is ovulated and potentially fertilised by the sperm, and the other 9 fritter away. When we're 40, it might be about 3, and so one ripens up and the other 2 fritter away. So we're undergoing loss of eggs all the time, whether we ovulate or not. Actually, this process of atresia is still going on whether we're taking the pill or not. So menopause is not made later by taking the pill for a life. It doesn't actually preserve fertility. And similarly, when we do IVF, one of the questions that ladies ask is, am I going to go through menopause? You've just taken 10 eggs out. Have you taken out a 10-month supply of eggs? But in fact, you can see that all that we've really done with IVF is ripen up those eggs that were contenders for ovulation for that month, where normally you'd only get 1. You've actually ripened up a full 10. That's what's the process.
Oh, right. Okay, just follow on from that. It seems to be a trendy new test around called Antimullerian hormone, and I've had a few people ask me, can they have that done, and how reliable is that as a predictor of fertility or future fertility, or how long have you got?
Yeah, that's a really good question too. AMH, as we call it, Antimullerian hormone, I think is a very useful test, and I've been using it in my practice now for about 18 months, 2 years. The thing about it is that it's a measure of the number of eggs left in the ovary, but it is still not a very good predictor of whether that woman will have a live birth. I.e. a baby. And for instance, you might have a low AMH of, say, 1 in a 40-year-old. Well, that woman is really in trouble because she is 40 and she has a low AMH. Whereas that same level of AMH in a 30-year-old woman would tell me that this woman is running out of time, but she will actually do quite well on an IVF program because her eggs are only 30 years old. They will be actually pretty reasonable in quality and will form reasonable quality embryos and will give us a reasonable chance of having a baby. The importance is that AMH is a predictor of the number of eggs that you get during an IVF cycle. That's actually what it is quite a good predictor of. I actually think it will probably one day be a test for polycystic ovarian syndrome, actually, because ladies with polycystic ovarian syndrome have more eggs in their ovaries than women who don't have polycystic ovarian syndrome, and their AMHs are actually higher. So it may in fact one day be a test for PCOS. It's not at the moment, but it may well be in the future. So I think AMH is actually quite a useful test. Unfortunately, it's not funded by Medicare at the moment, so people do have to pay about $70 out of pocket for it. But I think as we're finding our way as clinicians, we're really starting to find that this is quite a useful clinical tool.